Sharon Hanley from Hanley Consulting and Managing Director. We formed in 2009. We're currently based in Tring in Hertfordshire, and we've been working in primary care for the past 20 odd years.
My name is Max Gatlin. I'm Sharon's son. I joined the business in 2020. 3 months into the COVID pandemic, there was a rush to deploy digital booking platforms for people to get their vaccines, and I joined to help and support with the deployment of those technologies. And eventually we grew that, and those projects snowballed into supporting with cloud telephony, online consultation tools, and all kind of digital tools which are in primary care at the moment.
Hanley Consulting is very much involved in all levels of the spread across the NHS, looking at how we can help them use their tech to better manage and be more resourceful as well, and sort of saving time. We very much believe that the benefit to all of this tech is at scale. So when NHS England brought in primary care networks, the whole ethos around that is to work at scale, reduce cost, improve impact. And so we very much run along those lines.
I mean, our strapline is improving healthcare through technology. So the mission of the company is to enable these healthcare organisations to deliver better care through more efficient use of their tools. If we can leverage technology and free up their time, they can spend more time, delivering care direct to patients.
I'm Ellen. I'm the Patient Engagement Lead at Hanley Consulting, specifically focusing on improving access and the experience in primary care. With our private sector clients, we specifically focus on surveys and, most importantly, with measurable data through the surveys we've conducted for them. So Hanley Consulting saw a little bit of a gap in the market where perhaps staff and patient engagement wasn't being properly measured, and this is where we started looking a little bit more into the survey offering, talking to patients and surveying patients to get a really good understanding of how they feel about the care that they've been provided, the technology they're being provided within their practice. So this was around 3 years ago now. We used SurveyMonkey to measure both patient and staff engagement. When we moved over to Zoho, we saw this as a great opportunity to actually migrate as well into their survey capabilities, which has been brilliant for us. And most importantly, it's allowed us to transfer any data that we've had from SurveyMonkey into Zoho, so we haven't lost anything. For us, that's made a huge difference. Last year, we were approached initially by one PCN within Buckinghamshire, and a PCN is made up of multiple GP surgeries. Through that line of work, it actually led on to 6 further PCNs coming forward, so surveying in total around 300,000 patients. We had a brilliant response rate of around 16%. Difficult in healthcare as it is to get feedback through surveys, but we sort of base around 10% as a good response rate, and we reached 16. And ultimately, through conducting this survey work, it allows our PCN network managers as well as practice managers to make better data-led decisions, obviously tying up with Hanley Consulting's overall mission, which is to improve healthcare through technology, and that's what our surveys are really focusing on. So in summer 2022, the NHS launched a new initiative which was specifically focusing on enhanced access. This was getting PCNs to explore what current appointment availability that they have, and actually talking to their patients to understand where more appointment slots would be beneficial. So that was looking at weekday morning slots, weekday evening slots, as well as weekend slots as well. Interestingly, it did differ across each PCN, which is why the surveys is so important to conduct. I think there was an assumption that everyone would want particular appointments, but the surveys really highlighted the fact different demographic areas wanted different slot availability. So I think what's so brilliant about using Zoho Surveys is it's really easy to build the survey itself. It's a drag and drop feature, very well labelled, very easy to know which question type you need to apply to the particular question you might have. It's also brilliant because you can brand it, which is particularly important with NHS. We need that for trust. People need to know it's coming directly from their practice. And also complex logic as well is very important. Obviously, we have many different opinions that come through when it comes to someone's healthcare, and that means that we can build one survey but actually make sure that we're interacting with those that perhaps aren't as happy as others, and it makes sure that they are leading to the correct question types based on the answers to previous questions. Often in the NHS, we are looking at either an NPS rating or a 5-star rating. And with the logic routing, it enables us to investigate a little bit more. So for example, if a patient rates something 0 to 2, we would want to say, sorry that you feel that way. Could you tell us a little bit more about what you're not happy with? Whereas if you've got a 4 or 5-star rating, we'd want to say, that's great. Please tell us why you had such a great experience. When all the data itself comes through, so when your survey's closed, you can then go through to your analytics page within the surveys, and there it's really easy to filter on whatever demographic or practice that you might want to delve into. You might want to look at one specific practice and look at, say, the 45 plus. Really easy to filter and pull out that data. You can also run comparison charts. So we've done, for example, a staff surveyed them right at the beginning of launching a product. We then surveyed them again 3 months later and then again 6 months later. And what it allows you to do within the analytical module is compare those results comparatively over time. So you can look at where perhaps staff satisfaction has increased over that time or decreased. The time data comparison isn't something we would have been able to do in SurveyMonkey. A number of clients are focusing on the access improvement plans this year. We are planning to utilise this survey tool within Zoho to work with those specific clients, measuring patient engagement at this current time, how access can be improved for them. So throughout our surveys, it's brilliant because we can allow ourselves to measure quantitative data as well as the numerical data as well. And I think it's brilliant because our patients can tell us in quite a lot of detail how they're actually feeling. I think what's really nice is that you can tie up the surveys into obviously personalised emails through the CRM. So for example, we've got all our PCN managers. We did survey them prior to Christmas, just more about the service that we're providing to them. And that was really easy for us to do, build an email template, embed the survey, off it goes and just go straight back into the system. So in terms of sort of human interaction in that process, it was very hands off.